bringing together voices in child and youth healthcare. This is CAFC Presents.
CAFC would like to thank the following Keystone funding partners for their ongoing contributions that support all of CAFC's programs and activities. The Stollery Children's Hospital Foundation, the BC Children's Hospital Foundation, the Children's Hospital at London Health Sciences Centre, the Alberta Children's Hospital Foundation, and the Children's Hospital of Eastern Ontario. CAFC would also like to thank the organizations that provide funding for our knowledge translation activities, which include this CAFC Presents webinar series, the CAFC Conversations blog, and the Knowledge Exchange Network. And as CAFC celebrates its 50th anniversary, be sure to sign up for our weekly newsletters, follow us on Facebook and Twitter, or subscribe to our YouTube channel to stay up to date with our latest webinars and to track our activities as we celebrate our 50th year. All of our webinars are recorded and can be found on the CAFC Knowledge Exchange Network. Use the CAN to share these recordings with your colleagues or register an account and post comments, links, or other resources that you think would be of interest. If you have any questions or comments for our panelists, please type them into the question box or share them on Twitter at any time during the presentation. Don't forget to tag @CAFC Tweets and use the hashtag CAFC Presents. Hello, everyone, and welcome to today's episode of CAFC Presents. I'm Doug Maynard, the Associate Director at CAFC, the Canadian Association of Pediatric Health Centres. And today we're going to be talking about young carers, and the title of the session is Young Carers Amplified. But before we hear about that, I just wanted to take just a brief moment to mention the 2018 CAFC annual conference. The theme this year is Fresh Thinking and Brave Ideas, and that conference is coming up just in a few weeks, October 21st to the 23rd, and that will be held in Edmonton, Alberta. And I'd like to make a quick thank you to our colleagues at the Stollery Children's Hospital and the Glenrose Rehabilitation Hospital, both in Edmonton, for all of their support and hard work that their volunteers have been putting in to help us get ready for this event. The full program is up on the website, so is the links to register or to book a hotel room, etc. There's still lots of time to register, but time to book a hotel room is running out, if not already passed, actually, now that I think about it. But do check the website for all of the most up-to-date information. All right, so without any further ado, I'd like to get on with onto the presentation. It's my pleasure to introduce today's panel. We have colleagues from both the Change Foundation and from the Holland Bloorview Kids Rehabilitation Hospital. So first, it's my pleasure to introduce Christa Haanstra, who is the Executive Lead for Strategic Communications at the Change Foundation and also leads their work on young carers. I'd also like to mention Catherine Monk-Segal, who played a big role formerly with the Change Foundation, but played a big role in helping us put this together. So a big thank you to Catherine. And joining us from the Holland Bloorview Kids Rehabilitation Hospital is Melissa Nago, who is a family support specialist in the Family Resource Centre at Holland Bloorview Kids Rehabilitation Hospital in Toronto. And we also have Daniel Scott as well from the same organization, who has a background in early childhood education with a specialization in child and family studies. And he has been at Holland Bloorview for 8 years as the outpatient playroom administrator and the children's engagement strategy lead for the hospital's Children's Advisory Council. And finally, we also will be hearing from Liam Durek. And Liam is a young carer who has offered to share his lived experience caring for his younger brother who has autism. So we're going to be hearing lots from Liam, and I want to say a special thank you to Liam for being willing to share his story. So first off, it's my pleasure to hand the virtual podium over to Christa. Over to you.
Hi, everyone. It's a pleasure to be here today. Doug, I just want to make sure we've got the right screen showing.
Yes, we do, yes. Okay,
great. Thanks so much for inviting us to talk about young carers today. I actually want to start off by asking you, the audience, who here knows what a young carer is? I just want to get a sort of an understanding of, in the audience, are there people who actively work with young carers and know who they are? Or is this the first you've heard of them? So while you're taking that poll that Doug is setting up for us, I'm just going to do a bit more of an introduction. So as Doug mentioned, I oversee the Young Carers program here at the Change Foundation. For those who don't know what the Change Foundation is, we are Ontario's healthcare think tank. So we're a provincial organization located in Ontario. We're independent, funded through a large endowment that allows us to be independent of private donors and government. And we take an approach of picking one topic every 5 years and focusing deeply on that topic by listening, learning, and acting in that area. Our current focus is family caregivers. And we have a focus on young carers under the umbrella of our work with family caregivers. So I've been working in the area of young caregivers for about the last 2 years, and what we're going to talk about today is the insights that we have based on our listening and learning and working closely with young carers over that period of time. Doug, do we have some results from the poll? Just wondering how many people know about young carers.
The results are in, and it looks like 68% of people have said yes, they know what a young carer is. 16% said no, and 16% said unsure. So a fairly knowledgeable audience.
Thanks, Doug. That's helpful. We find that most people we talk to don't know about young carers, so I'm thrilled to know that there are a larger group on this of this audience that knows about young carers, which doesn't surprise me given we're talking to people who work in pediatric health centers. So that's really encouraging. Hopefully today you'll get to know a little bit more about young carers through what we're about to present. So here at the Change Foundation, we are committed to co-design in all the work that we do. And that means that we work alongside and partner with, as equal partners, people with lived experience. So today I'm happy to introduce Liam, who's going to talk for about 5 minutes on his experience as a young carer. So over to you, Liam.
Thank you, Christa. So to introduce myself to everybody, my name is Liam Durak. If you're viewing the slideshow, I'm the guy wearing the jean jacket and the red hat, just so everybody knows. As described, I am a young carer. So the person that I look after is my younger brother. I have a younger brother named Kyle. So he's 22 years old, and Kyle's in the slideshow as well. So he's the one wearing the navy blue shirt on the right. So Kyle's 22 years old. So he is autistic. He's nonverbal, and his motor skills aren't very low motor skills. He's also 6'3" and nearly 300 pounds, and he needs a lot of supervision in the house. Because my mom is a stay-at-home mom, and she's like 5'2", so you can imagine how intimidating it would be for her with that. So I essentially help her out and make it a little bit easier for her. So as far as my situation goes, living as a young carer, currently I am in my last year at Trenton University. I'm studying for sociology, so I will be graduating from Trent in April. It's been a very, very enriching experience to take that program. As for a career right now, I'm just working part-time at the Sobeys warehouse in Whitby, Ontario. It's a manual labor job. I've been off for the last 10 months, though, as I've gotten into a car accident. So I've just been laying low and from that for now, and using the spare time that I have to help out a little bit more. So what else is there? So basically the living situation is I still live at home with my mom and my dad and my brother. Like I mentioned, he needs a lot of supervision. So usually what we have support in the house as well. So we usually have some support workers. We have a team of staff that we handpicked ourselves. They come in the house from Monday to Friday, 8 a.m. to 10 p.m. Sometimes we'll have them on Saturdays. I mean, it's a great thing and helps us a little bit, but it does come with a cost, and that's privacy. We feel like there's people in our house all the time, and me and my parents can't really unwind and do things that, you know, other people would have the luxury of doing in comfort because you have people watching you all the time. But so that's just like a little backstory about myself. But what has my sibling taught me in particular? Kyle's taught me a lot of things. He's taught me to have a lot of patience, a lot of understanding, a lot of empathy. And as much as it's hard sometimes, it's made me aware of how fortunate I should be. How fortunate I should be, you know, to be in the situation I am where I'm able to go to school, I'm able to get an education. You know, he is my only sibling, so it's not like I have to argue with him or fight with him over stuff that other siblings might have to fight over. So there's that. But for that, he's definitely taught me a lot of valuable life lessons. And I'm very, very happy, and I wouldn't change it in that sense. I was asked to describe a time where I felt helpless or I didn't have the capacity to support my sibling. And to tell you the truth, I feel like really helpless right now. As much as I'm around him all the time, I still feel helpless, like in my own self, I just want to be able to have a space that, I can feel comfortable in, as well as my parents. I'm really concerned about my parents, especially because, those two are the ones that made me who I am, and I really look up to them. And I really don't want them to have to deal with this situation for the rest of their lives. So that's why I try to do what I can to help them out. So I just want to be able to have a space that we can have a comfortable life without having to sacrifice my brother as well as our own personal needs. So it's as tough as it is, it's definitely taught me a lot. And it's just made the quality of life a little bit more, as much as it's stressful, it's definitely opened my eyes to a lot of things. And that's pretty much all I can say about that. It's just been a incredible experience, and as challenging as it is, it's really changed my life in more ways than one. And I just want to do the best that I can, and hopefully I can continue to have him bring the best qualities out of myself. So that's me. That's Lee.
Thank you so much, Liam, for sharing your story. It's always something that we ask people to do because we know it grounds our conversations in reality, but it's never an easy thing. So thank you very much for sharing your story.
Not a problem. I appreciate it.
I think you can hear through Liam's story that there are really two sides to the young carer's coin, and we'll talk a little bit about that later in terms of the impacts of young caring. I do want to just talk about how we define young carers more broadly. So you've heard Liam's story, and when we talk about young carers, we're talking about young people or children between the ages of as young as 5 and up to the age of about 24. And these are these are youth and children who are providing support to siblings, parents, or grandparents. We do find that young carers often are more willing, and it's easier to talk about caring for a sibling than it might be talking about caring for a grandparent or a parent. So to the audience we're talking about today, most of the young carers you would be seeing are those caring for a sibling. But we don't underestimate the possibility that they might also be supporting a parent and grandparent in that home as well. So the kind of support they provide is from emotional support to added home responsibilities to caring for sibling, medication support and help, and administration. And what we find is that interpretation is actually a role that a lot of young carers play in the healthcare system. That is doing the translation for their parents. That's typically when they're caring for a parent or a grandparent. And we do know, although on this call, there's a lot of people who've heard of young carers. In general, there's very low awareness of young carers, and we consider them a hidden population. So the other thing I want to talk about is just to put this in context in terms of how many people are young carers in Canada. It's not a small issue. We know that there are 3.3 million family caregivers in Ontario, and of that, 17% are between the ages of 15 and 24. If you want to look at that in a different way, 28% of those between 15 and 24 are young carers. So the population of 15 to 24-year-olds, 28% of them would classify themselves as a young carer. I think the other thing that's really important to note here is that the data only talks about those who are 15 and older, but we know that there are many young carers under the age of 15 who are completely left out of those statistics. So all that to underscore the fact that this is not a small issue. So although young carers is a relatively new point of discussion in the public discourse, there is a seminal report that was done in 2012 by Grant Charles, who by all definitions is the grandfather of young carers research in Canada. And you'll see on the screen there what he talked about in his 2012 report, which is that young carers provide primary care. They don't stop caring at age 18. And I think this is an important piece that, we've heard Liam talk about already as he's into post-secondary education. But when we look to other jurisdictions like the UK, that transition where they're a good 10 years ahead of us probably in terms of supporting family caregivers and young carers, they've actually identified young adult carers as those going through transition in their own lives as a very important and distinct group of young carers who they're now starting to customize supports for that group. So the sort of 18 to 24-year-olds, they're looking at a different kind of support that's required through those ages of transition. We know that there are many different circumstances of young caring, even if you think about the divide between caring for a sibling versus caring for a parent, especially if you're in a single parent home, and caring for a grandparent, all of those would be very different. Context matters, and I think, again, not necessarily relevant to this group so much, but when you think about how it would be caring for a parent with a mental health or addiction problem, it would be very different than caring for a sibling with a disability. So it really does matter. It really does impact it does have an impact on the experience and how that feels. And being able to feel like there's choice and control and being able to feel supported is really important, which we have a lot of gaps here in Canada related to young carer supports. And it does impact and disrupt normal development, which we will talk about a little bit further in a minute. Oops, sorry, I skipped ahead there. So just to take a step back on the work that the Change Foundation's been doing in Ontario with young carers. When we originally started this, we could only find 3 young carer organizations in Ontario, and actually found one organization in BC, which is the Cowichan Family Caregiver Support Society. And that organization, I would say, is the one that started, was the first in Canada to start supporting young carers. And they had a bit of a hiatus in their support over the last couple of years, but over the last 6 months, they've filled the role for young carer supports and are getting active again in that area. So when we could only find 3 young carers organizations in Ontario, and we did travel to other jurisdictions to learn a little bit more what was happening there, we realized that actually if we we searched different terms and we actually looked at programs and services within larger organizations that we might find a few more. And we did find a few more. So this is on the screen here represents the organizations in Ontario that we could find that provide some regular support to young carers. And so I know that this doesn't represent the Canadian landscape, but I would encourage you to take a note from this slide in terms of the types of organizations that tend to get involved in young care support. So Alzheimer's Society and the hospice and palliative care sector are very active, as well as those chronic disease organizations, especially where there's a genetic component. They definitely seem to have a higher focus on young carers. And it's not always easy to find, but they are out there. So once we found the 10 organizations in Ontario and we started to connect with young carers directly, like Liam and others across Ontario, we hosted the first Ontario Young Carers Forum, which brought together 20 young carers from across the province, as well as those working with young carers, the researchers that are in across Canada working in the area of young carers, and policymakers. We also had the Ontario Patient Ombudsman here, as well as representation from the Provincial Advocate for Children and Youth. And so we brought some people who were actively working in the area of young carers, along with policymakers and decision makers who were just thinking about this for the first time, and brought them together to start talking about what we need to do in Ontario and in Canada for young carers. I'm going to pause here and show a video that was created with all of the young carers at the forum to, again, lend the voice of direct young carers to this discussion today. So I'm going to turn it over to Doug to show you a 5-minute video, and then I've just got a couple more slides before I hand it.
I take care of my brother. He's 21. He has cerebral palsy.
The person that I care for is my younger brother, Kyle.
We are high school students who are young carers in Toronto for our grandfather who has been hospitalized for the past 5 years.
I'm a young carer and I care for my sister who is now 30 and she has traumatic brain injury.
Sometimes certain young carers don't want to be identified as a young carer because it comes with a label, right? Like you can choose to be labeled a young carer and that's all you want to be.
I feel like I laugh to cover up my pain.
We have a lot in common, but I think there's also a lot of differences.
Is young carer as a concept or role or literature actually new? Or as we just heard, is there communities like Indigenous communities, like Black communities, where there's been a history where young people actually look after their family?
I hope we get our, stuff figured out. We support other young carers and people will support us and give us what we need to become successful in the future.
And what we would add is the need for capacity, dialogue amongst the system, not having to constantly repeat ourselves or our stories, and to coordinate care plans.
And also, this shouldn't be something that we are just looking at a provincial standpoint. It's something that we should be looking at to implement nationwide in all of Canada.
If I had any advice for young caregivers, I'd say to have somebody to talk to.
There are ups and downs, and with the right supports and services, it could be made easier for those that are taking on so many more responsibilities.
It's a heavy burden to have on yourself, especially as a kid and you're in school and you're trying to adapt to school life and there's the pressures of school and then you have your own stuff going on and then you have your parents and you're guilty. So I would say to make sure that you have someone to talk to or kind of have a way to vent.
We all will have different needs and we all have different things that we want. Some people will want to identify and some people want more privacy.
That these systems should be working in a way that we can go to school and understand and plan our lives. I shouldn't have to hear young people being I'm not going to go to university because I have these responsibilities, right? And that shouldn't be how the system works.
If my brother gets the help that he needs, that means I'm going to have a better time. So I feel like that's something that should improve.
Ben had a really great comment that said no one should have to ever make the choice between their family and their future. So as much as the support group is great, it's not just about emotional support, it's about practical support and giving them resources.
I just feel like I'm closer to everybody in this room. We're all in a certain situation, we're not at the points where we want to be, but if we associate ourselves with the right people, we can do great things. It's like on a sports team, if you have the right people around you, you're going to be closer to getting that championship.
As a young carer, it's just it's something beyond amazing. And I think it's so important for young carers, for us, to surround ourselves with the right people and the people who are willing to try and put as much effort into us as we put into the people we are caring for.
Thanks, Doug. I realize I jumped ahead. I had the video and a few slides, so my apologies for keeping you on your toes. But thanks for getting that up there. I just want to double check that my screen is showing the right screen again.
Yes, it's showing the right screen.
Okay, great. Thank you. So that gives you a little bit of a sense of the type of voices we heard at the Young Carers Forum. And ultimately, we as a group of those who attended, all those young carers, as well as the others I mentioned earlier, identified 5 priorities for young carers in Ontario. And they're what you expect them to be. So we talked about increasing the awareness and understanding of young carers, finding better ways to identify young carers, because identification and self-identification are the first step to being able to advocate and get services in place, links to the education system, especially as it relates to identifying young carers, because we know that those who have young caring responsibilities show up in schools probably before they show up in a healthcare system. So that's where we need to partner with. And related to that, really looking at an interministerial and intergovernmental approach to supporting young carers, because it really isn't one part of the system, the healthcare system, the education system, social services that can do this on their own. It needs to be a collaborative approach. We talked about building an alliance of young carer organizations. So those 10 organizations that support young carers in Ontario, it was the first time that many of them had met or even talked to each other. So the opportunity to start collaborating and sharing resources and knowledge is really powerful. And working with the Ontario government to make sure that young carers are included in the new caregiver organization that was announced earlier this year, which is still in its infancy. So those were the priorities identified in Ontario, although I would argue that if you did this across Canada, that you would end up with a similar set of priorities. So here's where I was originally going to play the video. So thanks again, Doug, for getting that played earlier on. This is a picture of the young carers who were in attendance at the event in November. And in the video, you see some of the young adult carers, but here you start to see some of the younger ones, as young as 12, who attended the event in November. So as we said earlier, there really are multiple sides to the young carers coin, and I think we heard that in the video, and we also heard that through Liam's discussion earlier, and I'm going to ask him to talk about that in just 1 second in terms of the impacts for him personally on young caring. But again, if we go back to that 2012 report, we know that there are costs and consequences of young caring, including added stress. They're more likely to be bullied at school. They're more likely to have depression. There's isolation. They don't have the same kind of opportunities for socialization with friends. And on the flip side, they are mature beyond their years and have a lot of compassion and empathy that comes from living as a young carer and seeing difference and challenges, health challenges from a young age. We do also know that there are real serious financial and career limitations, and those impacts were seen again in a survey we've just done here in Ontario, which we're going to release the results of in November, called Spotlight on Caregivers. And we definitely see that those financial and career limitation impacts are across the board for family caregivers, but are especially relevant when it comes to, and detrimental when it comes to, young carers. So I'm going to ask Liam to talk for about 3 minutes just in terms of his own personal experience, sort of bring these stats and these bullet points to life through his own experience.
Thank you again, Christa. So as stated, being a young carer myself, there definitely is some drawbacks, and there definitely are some effects of that. So touching on the bullet points that are you guys can see in the slideshow, stress and anxiety is definitely one. It always lingers in the back of your head, the idea of, when you leave, because as I mentioned before, I'm in school. So sometimes it's kind of like second nature for me to think about if my mother is okay, if I'm out of the house. Even though we do have some support workers here and there, it is still something that's second nature to me to think is she okay? And then that kind of takes away from me, giving my full attention to school or whatever else I'm out doing. It always constantly remains in the back of your head. Anxiety, it does make me anxious a lot of the time when I'm around my brother. It definitely does make me feel anxious because you never know how he's going to react. It's very hard to read my brother in particular. In my circumstances, it's very hard to read him. You have to keep him pleased, or else he does get very aggressive. So it's not something you want to play. You don't want to play with fire in my circumstance. How else would I touch on this? I'd say as well, as far as like my relationship with my parents and everything like that, I definitely wouldn't say that I've ever resented my parents in any way in regards to, them giving attention to my brother. That's another thing as well. Like, my parents giving attention to my brother. And I understand that. I don't resent them for that. But if anything, I wouldn't say resentment is the right word because it's very strong and very negative. But I feel like I kind of, how do I say it? I feel like I've been frustrated with my brother more times because, like, when I see him hurt my parents or he hurts me or something, it doesn't register that it's not okay what he's doing, and it sucks to see that, and you kind of resent the person you're looking after a little bit because you just wonder, like, when will you understand? When will you learn? So I mean, it's a little bit frustrating as far as like my social life or like my romantic life or anything like that. I mean, I still try to manage to have some type of social life. Obviously, I gotta plan it accordingly. But my key to it is that I just got to surround myself with the right people. And fortunately, I'm very lucky to have a couple of friends that I can count on, and they're very understanding of the situation, and they've been nothing but positive. And that's been a huge support system for me. And what else would I touch on here with that? I mean, I definitely say he's controlling of what goes on in the house. Like I mentioned earlier, he's aggressive, so you don't want to test his patience in that way. But I mean, the best way I can deal with it is just keep moving forward. It's tough to say that, and it's kind of generic to say to keep moving forward and move on, but it's something you just got to do. You got to roll with the punches, and it's not easy, but I don't like to complain. I'm not one to complain, so that's how I deal with it.
Thanks again, Liam. We really appreciate it. It does help, again, to sort of you can talk about this for a long time, but when you hear the personal impacts, it always makes it feel more real. So thank you.
Absolutely.
So just to wrap up here, I wanted to just let you know that through our work on young carers, we have gone and looked internationally at what's happening. And as I mentioned earlier, the UK is really the leader in supporting young carers, and there are programs throughout different parts of Europe. And Australia also has some very active work in young carers, including an organization called Little Dreamers Online, which is a for young carers by young carers organization, which is really worth checking out because she's taken from the age of, I think, 16 to 10 years later, a little idea of supporting and creating opportunities for young carers to a very dynamic organization that has gotten some international attention. What I do want to talk about, though, really quickly is that there is legislation in many of these other jurisdictions that talk about the right to assessment and access to services. And there are young carer support programs across the UK and in the Netherlands as well, which there's a really big gap here in Canada when it comes to services. When we talk about what needs to happen, awareness is one thing, assessment is another, but there's very few places to direct youth for services. And so looking at how we can build that capacity is critically important. In places like Holland Bloorview that have built it into their programming, I see a lot more of that happening in the future because it seems to me that standalone programs are going to be a hard sell, but building it into existing programs and services makes a lot more sense. There are bursaries and allowances and other jurisdictions, some of which are relevant for young carers and some of which are not. So I know there's some advocacy happening in Australia to ensure that those are accessible for young carers as well. The last thing I'll say on this is young carer ID cards are a fairly common thing in the UK. We looked at them pretty extensively from a healthcare perspective, but the truth is they get used a lot more in schools because that's where young carers spend most of their time. That's not to say they're not helpful in a healthcare setting because it does validate the role and help providers identify young carers very quickly. But we did look at it extensively and it tends to be first and foremost used in schools. So I mentioned earlier there are young carers researchers in Canada Here's a list of them and their academic affiliations. I know that everybody has access to these slides, so you'll be able to look them up. I just wanted to give you a quick glimpse of the small group of researchers that are actively working in this area in Canada. And there is some work happening and some publications that are worth looking at. So we've highlighted a few of them here for you to also refer to after the webinar. So now I'm going to turn it over to Daniel and Melissa. Sorry, I skipped a slide there, to talk about the sibling workshop at Holland Bloorview. Over to you.
Great. Thank you so much, Christa. So Melissa and I are here today to really highlight the work that Holland Bloorview has been doing over the last few decades, actually, around trying to provide support to the young carers that we work with. As we go through, you'll hear us refer to them as siblings, because as Christa said, in a pediatric setting, those are typically the young carers that we encounter most. At the beginning, it did discuss, I joined Holland Bloorview about 8 years ago, and I've been working on this project since I came in. That being said, this year was actually our 25th anniversary of the session's beginning. So we ran our 25th Sibling Support Night. We run a program once a year, and it's really evolved over the course of time. 25 years ago, it was actually started by a woman named June Chu. She was a parent volunteer at the time who ended up joining the team as a family support specialist and worked at the organization for over 25 years. And she really was also a parent of a child with a disability. And this stemmed from something that she had observed in her lived experience and really wanted to build something that allowed parents to be able to come in and, share their experiences and hear about each other's experiences. The program itself began more so focused on supporting parents. So they would come in, share their stories in small groups, and it was really about helping to send them home better able to support their own children. It started with a panel of siblings, younger siblings, who would discuss their experiences, and then everyone broke into groups to kind of unpack what they had heard and relate it back to their own experience. And that was the model that ran for quite some time. When I joined the team about 8 years ago, we had shifted to a model that was more co-created, both with and for siblings. So when I joined the team, June actually asked me to come on and help co-facilitate the evening, because she knew I had lived experience as a sibling of somebody with a diagnosis as well. And that was really important to try and embed that. And I think over time, we've seen the shift in the program. It went from being a small panel and then small work groups to that was focused on parents to really being the panel and then breakout groups for the actual siblings as well. They were able to break out and discuss kind of what they had heard and how they related to it. And the goal was really to help support both the parents and the siblings. And as it's evolved over the last 3 or 4 years, we've actually really tried to embed a peer-to-peer component for both the young siblings and the older siblings. We built a program now so that the night opens with a panel of adult siblings who come and share their experiences with an audience of parents and caregivers, while the younger sibling participants step out and do their breakout groups and share their experiences. The goal is actually so to have the young sibling groups come back with questions that can be asked of the adult sibling panel. So we really wanted to build a model that allowed kind of that intergenerational transmission of knowledge and experience. For both the parents, it's an open forum discussion. For the parent portion, they can ask whatever they would like to of the panel of the 4 or 5 adult siblings. The representation is always as diverse as it can be. We try to represent the broad spectrum of families that we support. So again, developmental disabilities, physical disabilities, medical complexities, lifelong conditions, really making sure that somebody is there that represents each of those audiences, and so that no matter who is in the parent audience, they will be able to ask questions and get information that's relevant to their experience. And the component that we've seen the most success in is really this idea of having the young sibling participants, typically 7 to 14, those small groups coming back with questions for the adult sibling panel. When working with young kids, it's always hard to anticipate what you're going to get. And Melissa and I were never really sure how it was going to go over. As siblings, we both tried to imagine what we would have liked, but we weren't sure. And we started running it this way about 3 years ago, and the questions that came from the young sibling participants were actually very intense, very insightful, very in-depth. We get a lot of questions around, the future and, young siblings wanting to hear from adult siblings around what they see in their future or what their future is like now, getting questions around how they felt when they found out their sibling had a diagnosis or how to explain things to their friends in school. We get questions. These are all questions that came directly from the young sibling participants, and it was really, really impactful.
So I'm going to talk about the last 3 years and the feedback that we've gathered from all of these workshops and using that feedback to determine how we would develop future sibling programs and future sibling workshops. So you can see here on this slide that in terms of our feedback, we do collect it from the parent attendees, and we also collect it from the young sibling attendees. Our teenage or adult sibling attendees get the same feedback form as adults, and young siblings get a modified feedback form so that everyone can give their own suggestions and ideas meaningfully. We collect ratings of the workshop from families, but most of the data we collect is qualitative. And that's just because our session is very discussion based. It's very much Q&A and talking to the different lived experiences of siblings. So by collecting qualitative feedback, we're able to develop more questions for the upcoming years that are more relevant for our families. So typically we ask questions like, what was the best part of the workshop and what will you do with the information shared? So you can see on the slide that enabling the conversations between parents and siblings to allow for increased support at home is something that has come out from our feedback, and we've had 145 attendees. That number includes the number from our regular sibling program that we run every month as well. And we found that most people want to simply talk with their sibling children. What they took away with them was to open up the conversation. So I'm just going to read a few quotes that we've received from different family members who have attended. This is from a parent attendee in 2018. She very much enjoyed both sharing her feelings and chatting with the other people on the panel. She talked with us for quite a while afterward about the different family situations and what is hard for her versus others. I think it was helpful for the families, but also really helpful for my daughter and sparked a lot of good conversation at home. And I'll read another quote from a 9-year-old who came in 2017, who said, "I like that I can communicate with other kids." And then from a teenage attendee, that person said, "I like that the audience was able to ask questions. I'm happy to know that I wasn't the only one who felt certain feelings when I was younger." So if we go to our next slide, the other thing that we do with our feedback is that we are able to share with other people what they can do to support other siblings in their area. So for families, from our feedback, the main things that have come out of our sibling workshop feedback around what sibs want and need and solutions to challenges facing siblings. Also just things that we found from the Change Foundation's Young Carers Forum was echoed in this feedback as well, was that finding that safe space to share feelings and information and just to talk is the key. I think the most important thing that families want to do is to make sure that their child who's in a caregiving position is able to seek help when it's needed. And it's okay if other sibs want to meet siblings who are in their situation to share information with, to share feelings with, to share questions with. The impact of having a peer-to-peer interaction is so important too. parents might not always understand from a sibling perspective.
And then the thing that we've heard a lot from our participants over the years in regards to what healthcare providers can do is really start by trying to, as Christa said, ways of identifying young carers or sibling caregivers in your practice and making those a priority for the organization. The work that Holland Bloorview is doing right now around our new strategic plan has a mental health strategy embedded, and part of that is focused around care for the caregiver. And so it's really, becoming an identified focus for us over the next 5 years. And I think that's something that we've heard over and over again is helping to expand or broaden the concept of circle of care, and recognizing that, siblings as young as 5 or 6 are an active part in that experience and should start to become part of how organizations think of a circle of care. If you go to our next slide, we actually have had great success over the last year. Our hospital runs a fund called the No Boundaries Grant, and it's an opportunity for staff to submit programs or ideas that they would like to get funded. And Melissa and myself submitted for funding to run a Holland Bloorview sibling support program that would run as a part of the family education portfolio. And the goal was really to offer a holistic family programming, and it was to make sure that we were adding a monthly regular designated component beyond our annual workshop designed specifically for siblings of clients. Again, similar to kind of the small groups that do happen on our annual workshop, we want it to be a play-based model, and we want to support siblings of a broad age range. So on the side, it does say 7 to 18. The way we typically divide it is 7 to 12 or 13 is kind of the younger siblings, and then anything above that would be a separate teen group. We're actually going to be implementing this starting in November of this year. And the goal is really just to have them, again, come in, have a space where they can, relax and unwind and meet other people with shared experiences. And if they happen to discuss their experiences while they're there, great. The component is really half self-care and then half therapeutic around, being able to just be around people with a similar situation. The thing that we hear over and over again is being even around people with similar backstories is just so inherently therapeutic because you just know you're around people who get it. And so that's really what we wanted to build.
And in terms of the impact, as Daniel mentioned, we're able to run a holistic program for the whole family. So when workshops run, playroom support runs at the same time for clients who have a disability, and a sibling support program runs. And if they're all happening at the same time for the same duration, that means a lot of the parts of the family are able to access a space where they can either learn or share or ask questions or just be around people that they want to be around. Everyone can engage in a space that is safe for them. And there is also choice in what they want to participate in. So if a sibling wants to go to the playroom and be with their sibling who has a disability, they can choose to do that. If they want to be around other siblings and talk about their own lived experience, that's okay too. And if they do want to go into our workshop and learn about a topic that we might be presenting on, that's open to them as well. So there is that choice that's presented. And we find that, the biggest impact is making sure that everyone is able to access information and keeping those conversations open. So just like how we ask our sibling workshop attendees, we actually want to know what you will do next. So here's a little bit of a poll here. What is the next step that you are most likely able to take after this webinar? I'll read the options. So you can educate others about young carers, include young carers in care discussions, start a support program for young carers, or check out local resources for young carers.
And for this question, you can select all that apply. So don't feel you're picking only one. You can choose one or all or anything between. So we'll just give everyone just another second or two to finish up their responses. All right, we'll close that off. And it looks like the most popular one was educating others about young carers at 82%, followed by including young carers in discussions. The lowest at 6% was to start a support program for young carers, obviously the most resource intensive as well. And 53% said they would check out local resources for young carers.
Thanks so much, Doug. That brings us to the end of our formal presentation. So we are open to questions from the audience. We all have our mics live, and I know, Doug, you're going to synthesize the questions that are coming through to you. So you'll let us know what questions are coming forward.
All right. So as they said, type in any questions that you might have into the question box. The first few questions that came in were, and it was right before, Daniel, I think you went into a little bit more detail on it just as these questions were coming in, but it was the whole issue of how do you identify that young carers, like how do you identify that there is a young carer involved in a particular situation? Some were asking, is it about specific processes? So for example, is it just simply about asking the question, whether it's the parent that has brought the child with a disability in? Is it just about asking them? Others were wondering whether the parent would even be aware that the sibling would be considered in a caregiver role. So they were just sort of some of those questions around, if you could give a little more detail maybe around process of how you go about identifying that there is a young carer involved.
Yeah, I can speak to it from Holland Bloorview's angle. I think for us, it's kind of, it comes at both directions. Parents will often come for the parental section first, especially when their children are younger and they're still trying to get a handle on exactly what a young carer is or what it looks like in their home. There's so many different ways that kids can be young carers, and sometimes it's very labor intensive and it's physically supporting your sibling and again helping with medication. Sometimes it's emotional support, again if there is a tense environment where there's aggression. There's lots of different ways that siblings take this on and that this becomes a part of their life. And I think what we often find is parents will come first on their own, especially when the kids are younger, to hear from other young carers, and then they often will bring their kids in the following year. In terms of self-identification, I think that's actually a really interesting topic, because I think everyone identifies at a different time in their life or in different ways. Even for myself, when I joined this team 8 years ago, this wasn't a label that I would have thought applied to me. And then it became so apparent that it was a part of kind of my experience. We never realized that the experiences we have as children are not universal. And so it's kind of a process of every young carer realizing that their experience might be slightly different than a child who didn't have a sibling that needed support.
I can talk to a little bit of that as well. Since I'm heavily involved in family education and I do work in the Family Resource Center, so I do meet with a lot of parents who are looking for information. And just by talking with them about what they're looking for, often it comes out that, I really want a program that, involves all of the members of my family, including these other siblings that might be a part of the child's life. And so even just by conversation and asking like, hey, what's going on with you today? And what are you worried about today? A lot of the times parents will identify that they might be noticing something that their other children are worried about, or their other children are behaving different. And that's when we kind of get into the discussions of talking about siblings as young carers and as caregivers as well.
So I would just add, it's Christa from the Change Foundation. The only thing I would add is that we find the language young carers does not resonate with people, or even the term caregiving. So I think what we would recommend also is to stay away from that. So questions like, is there a sibling or other child who's helping with your child with a disability, and describing tasks, as opposed to saying, are they helping to care? Because that doesn't tend to resonate. And that's part of the need for awareness across the board in terms of what that term means, or how we talk about the role of young caring.
And how often do you find a situation where the parents were unaware that the sibling was taking on a role that was maybe beyond what would be considered, typical, to the point where it was causing sort of the stress and anxiety and some of the other consequences that you had mentioned in the report that you identified at the beginning? Anyone who's grown up in a large family, the older sibling is often, stuck with the job of, quote unquote, babysitting and that sort of thing. So there's always often, an assumed role of involvement with a sibling, whether there's a disability or not. So I'm just wondering, how often is it that the parent may be unaware that the sibling has taken on more of a role than maybe they were aware, or that there's some of these consequences around the role that they've assumed?
So just again, from my experience, a lot of parents are very aware that their kids are either thinking about something or worried about something or asking to help with certain tasks or wanting to get more involved or even pulling back from those types of things. So it's more so that they're not unaware of the caregiving role, but it's more that they're unsure as to what role their child is taking in taking care of their sibling, and how they should go about talking about that with them, and really exploring that idea with them, or why they're acting certain ways in relation to their sibling or to their parents. So, Daniel, I don't know if...
I think the other thing too is it's sort of an evolution for a lot of the families that I've worked with, where often parents will come in with questions or conversation topics around feelings of guilt around not being able to provide their child without a disability with as much attention, or concerns around kind of the emotional dynamic within the family as it pertains to kind of the parent's ability to support both the child with the disability and without. And I think that's often how the conversation will start, is those conversations around when parents are able to identify their own feelings. Then it's a great way to kind of stepping stone into conversations around what it means to be a young carer and what it means for the realities of what it is to be a sibling of somebody with a disability or with medical complexities.
Can I add something into this?
Absolutely, yeah.
As Melissa and Daniel mentioned, they mentioned like really, really great points, and they pretty much summed up what I'm pretty much going to say as well. But I feel like communication is a very, very crucial point when it comes down to the relationship between the sibling and the parents. Now, I can't speak for every young carer in this situation, because obviously, everyone's relationships with their parents might be a little bit different from one another, depending on, environmental circumstances and whatnot. But as for my situation, I feel like the relationship between me and my parents were very, very open, and we're very clear in communicating and understanding the situation, because it is a very frustrating situation, and everybody's trying to understand it. Like my mom and my dad, they're still trying to understand it. I'm still trying to understand it. And I feel like the best way that everybody can get the most out of it is if we try to understand it together. And that means opening the floor and asking questions and not having things off limit. And just being aware of the circumstances that are going on. But that's just from my circumstance. Like, obviously, my parents do feel like guilt sometimes, that they wish they could give me more attention and whatnot. But they're admitting that to me, and I'm understanding of that, because they have to do this because they feel they have to do that. And then in response to that, it makes me want to step up and make their job a little bit easier. So communication coming from someone who is a young carer, communication between everyone that's within the household. It's not even just with your parents. Like, even if it's like, if you're living with like an aunt or an uncle or like grandparents or something like that, I feel like communication amongst all the people that live in the household of the individual that you're looking after, very, very important.
And I think to build on Liam's point, the opportunity here for the healthcare field is really, looking at innovative or creative ways to involve siblings in the care experience, or again, broadening the idea of what a circle of care really is. Because whether or not the family is aware of it or ready to talk about it, or wherever they are in their journey, the sibling is a part of this, and it's going to impact their lives for a lot of our families forever. And so I think there's a great opportunity at a system level to look at how care providers can even engage or ask questions of the sibling, start getting a sense of the families you support and how the members of the family support that client in different ways.
Right, and with that, I think we will have to wrap up. We are out of time, but I did want to give the panel, and I know you guys are all in the same room there, and you don't feel you all have to speak, but I just wanted to give you a chance for any closing key messages or anything you'd like to leave the audience with. Christa, since you spoke first, we'll go to you first. Maybe you can just look around the room and facilitate that on your behalf. Just if anyone there has any closing messages you'd like to send the audience off with.
Sure. The only thing I would say is I think it's great that we had on this webinar 68% of people who know what a young carer is. I think our biggest challenge is trying to reach out to those who are not even thinking about this, because that's where we need to start to make inroads and building awareness, understanding, and ultimately action. Anyone else want to say a few words? Liam?
I don't have anything to say. I was trying to come up with something clever to say, but I mean, I guess you could say like this is this is a great conversation, and I want to thank everybody that's tuned in to this conversation, this panel that we did have today, and hopefully my story, my little bit of experience gives a little bit of insight, and this is one conversation that was important to have, and it's better to have this conversation. It's better to have one conversation than no conversation. So hopefully hopefully you guys got a little bit of insight. So yeah, thanks again, guys.
I just want to say thanks to Cassie and Doug and Christa, Change Foundation, and Liam for sharing your story. I think it's so important that we bring everyone together, service providers, families, and young carers, and just to, as Liam said, open up the conversation. There's so much that we can do when we all work together as a system.
Great. Thanks, Doug. That's it from this end.
All right. Well, thank you very much. And I'll echo the thanks first off to Liam. As you said at the beginning, Christa, when we hear from patients and families, it really grounds the conversation in reality. And we know it's not easy to tell those kinds of personal stories. So we really do want to thank you, Liam, for joining us today and sharing all that. And
of course, I appreciate it.
Yes, no, our pleasure to have you. And thanks, of course, to Christa, Melissa, and Daniel for joining us from the Change Foundation and from Holland Bloorview Kids Rehabilitation Hospital. We do our webinars typically every Wednesday at 11 a.m. Eastern Time, but it is coming up, as I mentioned earlier in the session, it's coming up to conference time. So this will be, we have a webinar next week, and then we'll be taking another short hiatus while we have our conference out in Edmonton. When you do get to watch the webinars live, you do get to contribute with your questions and comments and enrich this discussion. But when you can't watch live, we do record these sessions and make them available after the fact on the CAPC Knowledge Exchange Network. As I mentioned, our next webinar will be next week, October 10th, and we're happy to welcome back Dr. Kim Widger. Kim has presented a few times on our webinars over the years, but this time she'll be coming back to provide us with an update on a topic of palliative care, palliative and end-of-life care. And they have the EPIC program, EPEC, Education in Palliative and End-of-Life Care for Pediatrics. And she's going to be giving us an update on some research and evaluation of that program that they've just completed recently. So a great session coming up next week. Don't forget to register for the conference if you're able to join us in Edmonton, and hopefully we'll see you back at our next webinar. Bye, everyone.
Thanks, Doug.
Take care.